Well, good morning. Your catheter was removed today, and you're probably going to be going home after your prostatectomy. I wanted to go over some usual postoperative instructions. First of all, in terms of diet, you can eat anything. You can have a regular diet. Usually, I recommend having small portions and try to avoid beverages with carbonation, with a fizz, because your belly can really, your stomach can really fill up with a lot of gas, and you're not going to feel well. So, if you do have gas, you can take a medicine called simethicone. In the pharmacy, you might find it as Gas X. So you can use it after surgery, and that usually will give you some relief. It's important to take a fiber after surgery. I recommend either Metamucil or a Benefiber with a glass of water after surgery to prevent constipation, and to drink plenty of water. Just drinking a lot of water is important to prevent constipation. If you do have constipation and it's been 2 days and you can't go to the bathroom, you can take some milk of magnesia. So you can take a couple of tablespoons of milk of magnesia. I do not recommend using enemas or any suppositories. Very important. Do not use suppositories or enemas after this operation. Okay. With regards to the incisions, you're going to find many small incisions over the abdomen. You can keep them clean with soap and water. You can take a shower. The Foley catheter can get wet. It's not a problem. If you had a drain placed and it was probably removed the morning after surgery, before you went home, you can take the dressing off in 24 to 48 hours. It's okay to have some drainage for 2-3 days after surgery. Just put another dressing back on it. If it lasts beyond 3 days, you should let us know. That's important for us to know. Also, if you have a fever or you have a lot of blood in the urine, that the urine's really red, like tomato juice or Hawaiian punch, you should let us know. That's very rare, but it can happen. It's okay to have some new blood in the urine, especially when you start walking around the house. Just take it easy, drink plenty of water, and it should clear up. If I prescribed blood thinner, like Eliquis, after surgery to prevent blood clots, and you start having blood in the urine, just stop it for a day, and then you can start again if it clears up. But feel free to call the office, and we can help you with that. In terms of the genital area, it's normal to get some swelling of the scrotum, of the testicles, and the penis. Usually begins about the 4th day after surgery. So just don't be alarmed. It can get pretty swollen. Just take a towel. You can roll it up and put it underneath the scrotum to elevate the scrotum, and that should come down in 4 or 5 days. It's also normal to have secretions that are yellow at the tip of the penis, and that is not pus. It's usually just normal secretions of the urethra. Just keep it clean with soap and water. You can take some Vaseline and put it at the tip of the penis, just to keep the catheter sort of rolling in and out without causing much problem. The first couple of times, or when you finally go to have a bowel movement, when you're sitting at the toilet, you can have some bladder spasms, and basically usually that can be manifested by some cramping right over the bladder, and some patients can have some urine come outside the catheter instead of going through the catheter, just because the bladder's having a spasm and it goes out faster around the catheter than through the catheter. So just don't be alarmed. That can happen. As long as the Foley catheter bag is filling up, you're not going to have any problems. So if they're severe, just let us know. We can give you some medicine for that. But usually patients don't need it. Okay. In terms of pain medication, I usually recommend taking Tylenol for pain if you have it, and the Neurontin that I recommended in the office. If you are not allergic to aspirin, you can take some Motrin as well, and that should do the trick. If it's rare for patients to call us with pain, but if you need more than that, just give the office a call. Now, in terms of Blood clots. I may have given you Eliquis to take at home as a blood thinner, and you probably have the stockings, the thigh-high stockings. Just keep using them. Walk around the house every hour just to have some activity. If you're sitting in a chair, use an ottoman to have your legs stretched out. That helps with avoiding blood clots as well, and just a lot of activity. Okay. In terms of fever, you can have a fever for a day or two after surgery. After 2 days, just please let us know. It's very rare, but you can have it for the first 2 days. It's important for you to use the spirometer, which is the little blue and clear pipe thing that they're going to give you in the hospital. Basically, you have used it, so you know how to use it. Just breathe in deep, take a deep breath, every hour, maybe 10 times. If you don't have the spirometer, you forgot it in the hospital, it's not a big deal. Just take 10 deep breaths every hour. That's the most important thing. Just remember, no heavy lifting, nothing heavier than a gallon of milk, no strenuous activity. You can walk around the house, you can go up and down the stairs with assistance. I do not recommend driving with a catheter. You will probably be able to drive in probably about 10 days. So just be patient. Try to avoid having people come over to the house. There's COVID and people sick, and it's unnecessary. But you can be a passenger in a car, but I just wouldn't drive. Okay. In terms of what else? The pathology. So a lot of you may be anxious about hearing about your pathology. It usually takes about a week to have the pathology released from the laboratory. They'll look at the prostate in sections and the lymph nodes, if those were removed. And basically, imagine if the prostate is like a lime, like a green lime, about that size. Imagine if the cancer is a seed inside the lime. Okay, so they'll tell us if it was inside the lime, that it was confined to the prostate, or if it was sprouting outside the prostate. Sometimes it can be sprouting outside the prostate into the fat, or it can go to the margin, which is what separates the prostate, let's say, from the nerve bundles around it, or the urethra, or the bladder in the back. It's not common, but if it does, just don't be alarmed. Most of the time, patients who have extension outside the prostate or to the margin, we follow the PSA. We'll check it in 2 months, and then we'll check it every 4 months. And if the PSA stays very low, most patients don't need radiation afterwards, and we'll just follow you very closely. Sometimes we'll use some special tests, genomic tests after surgery. But the important thing is really the first PSA after surgery. Now, very important, that's been proven to reduce recurrence, is exercise. I recommend walking at least 1 hour every day after your catheter is removed. Exercising, trying to lose weight. It's been shown that patients who exercise vigorously after surgery and lose weight have better outcomes. Okay. Also, I will check your testosterone and vitamin D levels, which are important to have. Try to normalize with diet and exercise first. I usually do not recommend testosterone replacement until we try some diet and exercise first, and vitamin D supplementation. So good luck to you. Just be patient. There are some videos on how to improve your erections, how to improve your regain your continence as soon as possible, and you can find those on my page as well. So have a great day. Bye.